So this side of the implant's already placed. We just haven't put my screw in yet, but we can see that it's developed really nicely. You can do this, you can see that he's got a jawline, he's got a squareness, and this side's still not been treated yet, and this is the other side that does not have the implant. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results. I'm really excited to show you guys a custom jaw implant of my patient Matthew. We've been working together for about 6 weeks to get that proper contouring of his jawline that he's always wanted. I've shown you guys the facial implants in the past, and this is what I love doing. This is one of my specialties. There are options. You've seen a chin implant before. Chin implants are great. They come in small, medium, large. I'm able to customize them a little bit, but the goal truly is to just get some more projection or forwardness of that chin. Some patients wanted the added bonus of being able to contour their jaw with specific needs and shape, contour, and projection. The custom implant process is actually the most advanced method that I can offer. We get a CAT scan that is an X-ray, a special X-ray that comes in 3D. I'm able to use special software to design an implant that customizes to his desires.
Hi, my name's Matthew, and I'm seeing Dr. Dhir today for a custom jaw implant. Something that I've been thinking about for a while. I had got a chin implant, one of the pre-fabricated ones, about 3.5, 4 years ago. It didn't give me the exact results that I was kind of looking for. And I think the custom route is really gonna fill in all the areas that the chin implant that I have now just can't fix. I've been thinking about this for a few years, and I did consults with different doctors for a while, and I met Dr. Dhir, and he's one who specializes kind of in the custom jaw implant. There's not a lot of doctors that do it. With that area of expertise, with that type of implant, I just felt more comfortable pursuing it this route.
Good morning.
Good morning.
You made it. I'm so proud of you.
I'm here.
Welcome. We made it.
I know, it's day's here finally.
I'm proud of you, man. It's been a long process the last couple of weeks.
Yeah.
How you feeling?
A little bit nervous, excited, but I think I'm actually more nervous than excited right now.
Okay. Well, both are good feelings, right? They're absolutely normal. I do want you to know that I want you to enjoy this experience. We've had a lot of fun in the last 4 to 6 weeks.
Yeah.
And we're going to kind of go over it again. As we talked about, we do have options, and we went through them. Fillers are temporary. It takes a lot of them. You feel great, but then they kind of go away. You want something more permanent? We talked about prefabricated implants, which are implants that are just small, medium, large on both sides. But they have asymmetry. How much do you want to do? The shape is off, and you kind of wanted the whole jaw to match the 3 parts of our face.
Exactly.
So when we first talked, I said, the top third is very well developed, big eyes, cheekbones are developed, and although it's a nice jawline, you feel that it's not in harmony with the other 2.
Correct.
So we got a CAT scan, as you remember, and in 3D, this was able to show everything, and this came in. This is your jaw, as you remember. You have an implant in place, so the computer digitally took it away, and we were able to kind of design around this implant. It is small compared to the size and height that you have, so you were absolutely right. Anatomically, nothing wrong. It's just smaller. There's nothing you can do with working out in a gym.
No,
you tried.
I couldn't run on the treadmill with it.
Well, that's where I come in. I'm not here to say the world needs it. It's for people who try and can't. So I'm here for the next step, and it's totally fine. So what we can do is we had a long discussion of where you wanted to go. And I think and you sent me those pictures. And I think you did a really good job of finding at least something that was near the harmony of your face already. Because I usually don't like it when people say, I want to look like this. Like, that's not the point of this. It's taking your face, which you already love, and enhancing it to where you want to go based on that self-image that we all have in our head. So what you did was you showed me pictures that I thought were fair.
Okay.
Because they were kind of similar to facial features you already have. We're not going to make you look like him or her, but what we're going to do is we like certain aspects. So then you and I talked about those kind of 3 to 4 goals. It was the squareness of the chin, bringing it forward just a little bit more, plus the squareness, right?
Yeah.
That's where custom is great. And then also the angles, you wanted more of a jawline that's chiseled where the jawline to neck was exaggerated.
I definitely wanted that definition right in there.
So that definition also with some width.
Correct.
So we did all those things, and then of course, this was my favorite part, because by me taking a look at your pictures and talking to you, I'm able to make my first edit. And you and I had a nice chat, and we wanted to bring, this was too square, we brought it down, we wanted this to be a little bit bigger, we wanted it to be a little bit more defined, we wanted something a little bit, we wanted that concave, that kind of swoop, but we wanted a little bit more strength here. We finally got it exactly right, and this is the implant that we accepted, you and I love it. So we'll let you look at it one last time, is that we got that squareness, we got a little bit more weight here, we got the angles, we have a chiseled, we lowered the jawline by a little bit, and this is your new implant. So this
Yeah.
is what it's going to be.
See, when I see this is when I get excited. The nerves subside, and this is where all the excitement comes back in, because it's
Visually,
it's
visual,
like real
right?
life
Yeah.
now.
Visual and tactile, which I love. There's so much to this. Any questions about the implant? Now, as you know, this is just a model.
Yep.
This is silicone, rubber, just like you saw the prefabricated implants. So it doesn't, it's not hard. It's actually rubber, and it fits to your bone. It's custom made to your bone, so it actually snaps on. Because it's rubber, I will put a little screw right here and here. I know where the nerves are based on the model, so it'll just be away from the nerve. This is that nerve we got to kind of watch for, but I know where it is now based on visually. When it heals, it actually feels like bone. If you dig and you look for it, you'll find the contour, you'll know it's there, but no one else would if they did it, because it just feels like bone. That's the best part. And then when you wake up, you're gonna have like a head wrap with some ice things in it. Remember, this week, I changed my personality kind of from being fun or directed. I get very serious because I'm only worried about the few things that are bad. Infection and the wounds healing. So I'm more focused on that.
Okay.
I want you to be in good pain control, so we're going to give you medications. You have to go to an aftercare facility, so they're going to kind of watch you, give you your pain control. They know what to look for. They call me along the night to make sure that I know what's going on. And then when I see you tomorrow, I'll be a little bit more calmer when I look at everything and make sure it's fine. So then I'm going to see you at 6 days. Stitches will come out. I'll look to make sure the wounds inside the mouth are all healed. And then we get to start having the fun and excitement of watching this aesthetically be the goal that you've always wanted, okay? And remember that swelling is going to come down slowly. So this week you're going to look like a chipmunk. Do not judge the cosmetic result. That's up to me and you after the next week to talk about it. Another week or two, it's going to settle in and be acceptable, but not there yet. We'll meet in a month, and you got to give me till that 3 months before you're going to start to believe me. And then on the way in, what song are we listening to?
I want to hear Somewhere Over the Rainbow, the Hawaiian version.
Okay, so you want to go keep it quiet and comfortable. All right, man. Any other questions before we start?
No, I'm excited.
All right, let's go to Somewhere Over the Rainbow. All right, big smile. Yeah, you're going to do great.
Thank you.
My patient's asleep, he's comfortable, I have my plan in place, I'm excited, let's do this. Okay guys, I'm going to show you the incision sites. I know that one of the questions I get asked are how are you going to put this rather large implant into the jaw. I do it with minimally invasive technique, and so we learned this from doing my facial fractures. I like to keep scars to a minimum. I like to use creases when possible. He actually had a scar right here under the chin from his previous chin implant, so that's going to be the same place we're going to start. If he did not have a scar, we all have a crease. So if I do this, when we put our chin down, there's a natural crease that forms, so that's actually a perfect place to place an incision. So I'm going to actually use the same place that he has an incision to start, but this is where it's going to be hidden under the chin line. That gives me access to the front. We're actually going to go through the mouth for the 2 other incisions, 1 on each side. And once I elevate everything up to bone, you'll see how it gets placed, and then we sew them up. It'll be about 2 to 3 hours, depending what we like to do. So as you see right here, here's the implant, and I've loosened it so that it's ready to come out. And once it comes out, it actually helps me with some of my dissection because we have had an implant in place. Okay, and you can see here and here. So when I say prefabricated implants, these are prefabricated, meaning they come in small, medium, large. They're designed as a general implant, and you put the ones in different shapes and sizes. Find the one you like based on your discussion with the patient. My patients often tell me if they want a little bit of carving, I'll do that for them. I'll try to be the custom implant process for them. But sometimes we don't get the contour that we want, sometimes we don't get the symmetry we want, and patients want a little bit more control of the shape. So here's the first part of the procedure. Chin implant comes out, and now we're ready to get the rest of the procedure started. So now we're done. We have our chin implant removed. We have the incision well dissected. You can see that there's a little bony prominence here. That's actually a good thing. That's from the chin implant. The new custom implant will actually fit right on. It gives us something to lodge onto and know that we're in the proper position. So that's great. What we do is we take this dissection down to bone. There is a nerve right here. We protect it. I saw it. It's protected. And what we do is we just stay right on. You can see how it's a nice, beautiful plane. There's no bleeding. And I go to the corner of the jawline here. From inside the mouth, I'm able to also, it's going to be difficult to see, so I'll just show you again with my instrument, down to bone, and I've connected now to my, from the chin side, now I'm down to bone here, and now I'm able to pass the implant through because I have access to the complete jaw. Okay, so this is a shot through the mouth. Small incision, it looks stretched, but it's actually just a small incision the size of a nail bed. And it just stretches so nicely that I can actually make the incision very small and then get access to everything. And this connects all the way to the chin incision. As you can see, it's very dry. There's no blood. It looks healthy. It's gonna close beautifully. So I'm gonna show you now how we insert the implant. And this is a silicone implant. It's based on the model. The computer data is sent to a company that does a 3D printer, and it does it in silicone rubber. And as you can see here, it fits on like this. And so now we're ready to put the implant in. And so we're gonna start the process. One of the ways we need to start it is that we can't, unfortunately, put it through just the chin implant because this thing is so much larger than the distance I have for this nerve. If this distance was very far and it could fit in safely, I would do it as one piece this way and this way to fit in. But since I can't, we're gonna have to go backwards, and I'm gonna have to bring this thinner portion in, so we do have to cut it in half. So we're gonna cut the implant in an agreeable place so that I know where it is. So give me a knife, please. And I'm kind of using his natural midline here. And it doesn't matter, I'm gonna connect to it, so I pick one spot that's good. So as you can see, I attached a suture to my implant. This is the left side. By attaching that, I'm able to use this guide wire or guide thread into the incision site. Can you just pull on it, keep it taut, please? And what I use is this other instrument to grab it. And now we're able to feed it through and pass it along the jawline, as you can see. Good. So as you can see, I do that. And this is the beginning part of putting the implant in place, and then we do proper placement checks. I might use a screw to keep it in place, and this is how we start the process. All right, so here is the chin implant portion. It's connected right in the center. I had a dot right here at his midline, and if you can see straight down, it's right where it matches. It's sitting in that protuberance. It's locked into place. The sutures I just meant to make sure that's reapproximated. That little notch that I made, it's like a jigsaw. It's fit right in. So we are done with that portion. Here you can see the angle of the implant. I'm going to show you. I put a little screw in here just to hold it in place, not to secure it, but just to hold it in place while it's healing. And I'm going to let you guys see the result all around. So now that we have successfully inserted the implant, we are done. I've secured all my points. I'm very happy. We're gonna close the skin incision under the chin. And we're also gonna close the incisions inside the mouth, and then we're gonna wake him up and he'll be ready to go. All right, so we are done. The implant's been inserted, we've closed it, the wounds look beautiful, the jawline is taking shape. He does have some swelling, and most of it's gonna be the angle of the jaws. That's gonna start to come down the next couple weeks.
It's been 5 months for my surgery, and I'm finally feeling really good. I feel like I've come a long way. I remember the first couple months of healing were a little tough, and now I just feel like I listened to the doctor's orders and everything fell into place, and you know, I feel good with what's on the outside. It's matching now what's on the inside. The experience with Dr. Dhir has been, I couldn't ask for anything better, to be honest. He really laid the groundwork perfectly, you know, as to preparing me for the surgery, what to expect, what to anticipate, kind of helped calm my nerves with what needed to be calmed. During the surgery, he was right there. And then after, I think the after part and the aftercare that he provides has been one of the biggest benefits and one of the biggest emotional helps, I think, because there's ups and downs with this. And with his guidance, kind of expertise with this, he really helps calm you when sometimes you're overthinking or overanalyzing some things. The result was better than what I was expecting. It just feels like me.
Welcome back, bud.
Hey.
How are you?
Doing good.
You made it to 5 months.
I know.
Welcome back. All right, well, you're in a great spot.
Yeah.
This is like, I told you, it's an emotional trip because the first couple of weeks are very swollen. It settles down. I told you we're now going to have some conversations, which we did.
Yep.
We made it to that 1 month mark where you first see it. 3 months, you got to finally see it settle in. And by 4 or 5, we're kind of really getting to the point where it's really contouring and developing what we designed. Well, I'm gonna leave it up to you. Tell me, how are you feeling?
I love it, to be honest. It was like you expected. Like the first month and a half, 2 months were tough, but I think about 3 months it pulled together, and I feel good. I feel like it's what I want. So
that's one of the things, the powers of the custom implant, because you and I spent a lot of time, you know, we went through the design process, what you wanted. The 4 things that I really love to see right now is that we have that angulation that we have here. The width is really nice. We have that little bit of concavity, that little chisel that goes in before the chin starts. We have the squared chin. And of course, we got that projection forward. Your neckline now, I mean, people are dying about that, and I'm loving it. I'm kind of jealous too. But it looks really nice. When you do touch it, a lot of patients always do ask me, you're going to feel it? I would say it does feel like bone. Do you agree with that when you touch it? Can you even find it? Like I mean, I know where it is because we put it in, but it does feel like bone.
Yeah, I mean, I can't tell where it connects or anything. It just feels like, honestly, it just feels like bone the whole way through, all the way.
So it feels comfortable. Then look up for me. I want to take a look at that small incision is healed really well. We'll get some pictures of that. And then 1 to 2 in the mouth, which are hidden. You can't even feel it with your tongue, I'm sure. So, well, at 5 months, we're kind of in a great spot. I'm really proud of you. You really made it through.
Yeah.
And I know it's an emotional roller coaster. Totally. That's why I spent all that time with you, but I'm really proud of you. I know we have some adventures in your life coming up, so keep us updated on those adventures.
Definitely.
And when you get back, I'd love to see you at the year mark just to kind of see how things went and how things healed up.
Perfect.
Do you have any questions for me?
Is there anything that I need to know for the next
Live your life, man. Full exercise, enjoy. Take this jaw around the world. I want to hear all your adventures.
Thank you so much.
Right, so I'll see you in about
it.
6 months.
Okay.
All right. So as you can see with my patient's journey, that facial contouring is a very important part of facial harmony. Custom implants are a great way to give my patients the look that they desire. And the patient's happy, so I'm happy. Thanks for watching this episode of Plastic. Make sure to subscribe to Mixed Makeup, follow us on Instagram, and we'll see you next time.